Hello everyone, my name is Alina Chernyeva and today my project topic is lateral epicondylitis, or in simple words, tennis elbow. This topic is kind of close to me because I'm a tennis player, and so today I want to more deeply introduce this topic. So today I will cover such topics as injury description, symptoms of this injury, population risk, diagnosis, treatment and care, returning to sport, prevention, and I would like to share some interesting facts in the end. So, starting with injury description, tennis elbow, also known as lateral epicondylitis, is a type of tendinitis, swelling of the tendons that cause pain in your elbow and arm. So the pathological condition called tennis elbow was first described as early as 1873. 10 years later, doctors noticed a correlation with the disease and sports activities that require repeated flexion and extension of the forearm in the area of the elbow joint. Such movements are most often used in a big tennis, which is why the disease was given a similar name. So in summary, tennis elbow is a condition that can result from overuse of the muscles and tendons in the elbow. Here on the slide, the picture shows a medical vector illustration of tennis elbow. The extensor muscle of a wrist attached to the lateral epicondyli, bony sulcus, on the outside of the elbow. These tendons are bands of tough tissue that connects the muscle of your lower arm to the bone. The muscles and tendons of the forearm are damaged from overuse, basically repeating the same movements over and over again. This leads to inflammation or, in some cases, to microtrauma to the tendons that connected to the forearm muscles on outside of the elbow. So moving into some symptoms that can occur while you experiencing the pain and the injury of a tennis elbow. So the main symptom of tennis elbow is the pain and tenderness in the bony knob on the outside of your elbow. This knob is where the injured tendons connect to the bone. The pain may also radiate into your upper or lower arm. The pain has a nagging character, often painful spasm and manifested in the area of the affected joint after physical extension, while passive movements are not limited. During the examination of the elbow joint, it is necessary to determine the point with maximum soreness. Other symptoms may include weak grip strength. In tennis cases, it may include pain when holding a racket or shaking hands. Tennis elbow pain may be most intense when a person lifts something or opens a door, and sometimes the pain is felt even at night. It should be noted that the epicondylitis pain does not occur at rest, as well as during free flexion or extension of the elbow. This sign makes it possible to distinguish the disease from elbow trauma. Now to the population risk. Despite the name, you can get tennis elbow even if you've never been near a tennis court. Any repeated arm movements can inflame your tendons. Tennis elbow is the most common reason for elbow pain. It can pop up in people of any age, but it most hits people between ages 30 and 60. Between 1 and 3% of overall population has tennis elbow. The Nurse Orthopedic Center reports that half of all tennis players will be diagnosed with tennis elbow at some point in their lives. However, people who play tennis make up less than 5% of all reported cases of the condition. Me as a tennis player, I never experienced tennis elbow, and I hope I will never experience it in my life. So moving into diagnosis. Diagnosis requires a physical examination to assess the elbow for pain, swelling, and stiffness. The following tests are needed to confirm the diagnosis: X-rays, checks for arthritis or broken bones, other diagnosis tests such as ultrasound, magnetic resonance imaging, MRI, or computed tomography, CT, checks for muscle or tendon damage. EMG measures the electrical transmission of nerve cells and muscles function to see if a nerve is compressed. So now moving into treatment and care. Sometimes tennis elbow heals on its own with rest or of using of mechanical movements of the right arm, cold compressors on the affected area, and taking over-the-counter medications to relieve the pain. But if symptoms persist, medical treatment is necessary. So here are some treatments for tennis elbow. Treatment for tennis elbow depends upon the severity of your pain, but may include injections. Platelet-rich plasma is injected into the tendon. Dry needling, a small needle is inserted into the damaged tendon in various parts of the affected area. ESVT is a laser therapy. Tapes and braces, a supportive brace or tape will help reduce muscle and tendon strain. Like our team, personally me, if I have some pain in my arm or my knee and I want to protect it during my match, I always put tape before my match so I know that my muscles will be more protected. Here I also have how tape looks like here I have it. And moving into surgery, after 6 to 12 months that your symptoms still persist with all the other non-surgical treatments done, surgery may be the last resort to take out the injured tissue. The surgery can be done by cutting a huge incision or a lot of tiny incisions of an affected area. After the surgery, you must undergo physical therapy, which is important for your recovery. Now moving into returning to sport. The return to sport depends on the severity of the injury. If the injury is not severe, you can continue to play and recover. Sometimes only rest is enough. In other cases, the recovery period may take from a few weeks to 6 to 12 months. I will give an example based on tennis. So after returning to the court, the following recommendations should be followed. Warm up. Always warm up before your play. Before stepping onto the court, you should do a full range of motion in all major joints. In tennis, play light strokes at first and then gradually increase the intensity. After warming up, you should stretch the forearm muscles well. Racket. You need a racket with less weight and less string tension. Stroke in tennis, the backhand stroke puts the most force on the outside of the elbow, especially if the wrist is used. So a two-handed backhand stroke tends to be easier on the elbow. Game. When you're returning to playing sports, start gradually. Play less time each day, or in a tennis case, just play doubles. Avoid competitive play until your elbow heals. After the game, it is essential to stretch the muscle after the game is over. Also, you can put some ice on your elbow for 20 minutes. So now moving into prevention. So the best thing to do with tennis elbow is to prevent it before it starts. Preventing tennis elbow involves taking preventive measures and doing exercise to strengthen the muscles in the forearm. So here are some tips and exercises that can help prevent tennis elbow. Once again, warm up and stretch before any physical activity. This helps to improve blood flow and flexibility, reducing the risk of injury. Use proper technique and equipment. If you play tennis or any other sport that involves gripping and twisting of the forearm, make sure to use the correct grip and technique. Using a racket with a grip that's too small or too big can also increase the risk of tennis elbow. It's important to choose the right size and weight of the equipment to avoid unnecessary strain on the forearm muscles. Take breaks and avoid overuse. This helps to prevent muscle fatigue and reduce the risk of tennis elbow. And strengthening and stretching the muscles of the forearms will help strengthen the muscles and reduce the risk of disease. So now I have here some interesting facts that I would like to share. So as making research, I found out that some foods can worsen the condition of a tennis elbow. It's such food as the sugary snacks, fast food, and packaged foods. Processed foods these foods are high in sugar and unhealthy fats, which can increase inflammation and worsen tennis elbow symptoms. This food is already an unhealthy food that you already should try to avoid. And now also knowing that it can worsen the condition of your injury, it will be probably more easier to avoid this kind of food. So, and here's my sources and citations that I read to find the information. Thanks for watching. I hope you enjoyed, and I hope now you have a better understanding about tennis elbow.